Hi, my name is Rick Zaradnik, and today I'll be showing you how to apply foam dressings for the use with WoundPro Apex negative pressure wound therapy pumps, manufactured by Accuro Medical Products. The WoundPro Apex negative pressure wound therapy system may promote wound healing through the drainage and removal of infectious materials and other fluids from the wound site using continuous or intermittent negative pressure. Patients with chronic, acute, traumatic, subacute, and dehisced wounds, partial thickness burns, ulcers such as diabetic or pressure, flaps and grafts may benefit from the use of this device. Warning: the use of any WoundPro negative pressure wound therapy system is contraindicated for use on patients with any malignancy of the wound, untreated osteomyelitis, non-enteric or unexplored fistulas, or necrotic tissue with the presence of eschar. Never use any WoundPro wound therapy system where there are exposed blood vessels or organs. Do not place the Apex dressings over anastomosis or sutured vessels. First, make sure to debride any necrotic tissue and cleanse the wound and peri-wound area according to institution guidelines and physician's orders. Apply the skin prep to the peri-wound area and allow to dry until sticky for drape adhesion. Cut the ProFoam to the size and shape of the wound. Make sure that the foam does not overlap onto the peri-wound area. Place the ProFoam into the wound. If there is tunneling or undermining, use white ProFoam to fill the area. Push the foam into the tunnel and pull back slightly. Make sure to count all pieces that are placed into the wound. Cut a piece of the transparent dressing 1 to 2 inches beyond the wound border on each side. Create an airtight seal by applying the transparent dressing starting with one side to the other. Press the dressing down firmly around the entire wound to ensure the wound environment is sealed. In this case, more coverage is better. Once the wound area is sealed with drape, take a pair of scissors and cut a dime-sized hole for application of drain. The best way to cut is in an X fashion. After cutting the hole in the dressing, apply the drain to the drape. Remember to think about where you want the drain to exit to the negative pressure system WoundPro. Now apply the negative pressure and monitor the dressing to ensure that the dressing maintains a vacuum and the dressing is contracted. Be sure the volume of exudate being removed from the wound is within physician's expectations. If exudate volumes exceed physician's expectations, notify the physician immediately for further instructions. After the dressing has been applied, we recommended writing the date, time, and number of pieces of foam used to dress the wound. This helps the next person identify how many pieces of foam was used to make sure all foam pieces are discarded before the dressing change. For Accuro Medical Products, I'm Rick Zaradnik. Thanks for watching this instructional video.